An informational video from North Coast Medical. This video has been prepared to present important information on how you, as a clinician, can monitor and aid in the prevention of the potentially deleterious effects of diabetes mellitus on peripheral nerve function. Recent studies demonstrate that a simple tool that has been used for sensory testing in hand surgery and hand therapy for over a decade can offer significant benefit in identifying persons at risk for lower extremity wounds that may be caused or exacerbated by diminished cutaneous sensation. This tool, the Touch Test Sensory Evaluator, consists of a nylon filament precisely and individually calibrated to apply a predetermined amount of force when applied against the skin to its bending point. The test is non-invasive and the results are objective and repeatable. In December 1990, Military Medicine published Management of the Insensitive Foot in Diabetes, Lessons Learned from Hansen's Disease by John C. Duffy, MD, Director of the Gillis W. Long Hansen's Disease Center, and Charles A. Patou, Jr., MD, Director of the National Foot Treatment Center, both in Carville, Louisiana. The study states that diabetes mellitus is the #1 cause of lower extremity amputation in the United States, accounting for approximately 60,000 cases per year. While the combination of reduced blood supply and the loss of sensation to the foot in a person with diabetes are responsible for the high incidence of lower extremity amputations, in most cases, it is the loss of sensation that is primarily responsible for the initial foot wound and its failure to heal. It is estimated that 25% of all persons diagnosed with diabetes develop foot problems related to the disease. Treatment of foot problems and the related complications account for 20% of all hospital admissions for people with diabetes in the United States. 50 to 70% of all non-traumatic lower extremity amputations each year can be attributed to diabetes. However, there is good news. The Duffy-Patou study estimates that the rate of lower extremity amputations among people with diabetes could be cut by as much as 50% with the institution of basic preventive care. Drs. Duffy and Patou describe the screening processes designed and currently in use at the Carville facilities to test for levels of cutaneous sensation. The article states that the essential and fundamental element of the screen is the determination of the presence or absence of protective sensation. The nylon filament tester, standardized to bend at 10 grams of force, is used to test for protective sensation. This 10-gram filament has been found to be a clinically useful tool in identifying patients at risk. In September of 1994, the New England Journal of Medicine published Assessment and Management of Foot Disease in Patients with Diabetes by Gregory Caputo, MD, et al. The study states that in the majority of patients with diabetes, the initial condition that eventually leads to amputation is a skin ulcer. The simple technique of testing for sensory neuropathy with a monofilament can be used to identify patients at risk for ulceration and therefore most in need of preventive intervention. Screening for patients who have lost protective sensation is simple and non-invasive. The tip of the filament of a Touch Test Sensory Evaluator is pressed against the skin to the point of bending. Patient responses are recorded and the area is mapped. Patients who cannot feel the 5.07 Touch Test Sensory Evaluator are at risk for ulceration and require intervention through education. To perform a comparative evaluation, you will need the Touch Test Complete Foot Kit, which contains the 6 appropriate Touch Test Sensory Evaluators, foot screening forms, a color mapping example, and colored pencils. A comparative evaluation allows you to map out areas of normal or mildly diminished sensibility and track changes over time. Before beginning the test, draw any calluses, ulcers, blisters, or any other unusual appearance of the skin on the screening form. Testing should be done in a quiet location, away from noise and distraction. The patient must be able to concentrate on the test to respond consistently. Begin by testing an area where the examiner knows the patient has normal sensation. This demonstrates to the patient that the test is not painful, and the patient will then know what to expect from the test. Instruct the patient to answer yes when they feel the stimulus. Do not ask the patient if they feel the filament, because this may cue a false response. Hold the handle parallel to the area being tested. Apply the touch test sensory evaluator until it bends, holding it to the skin for approximately 1.5 seconds. When you are performing a comparative evaluation, apply the 2.83 and 3.61 up to 3 times in the same location. If the patient responds to the first touch, move to the next location. A response to any of the touches is considered affirmative. Heavier filaments should be applied only once. If the patient feels the 2.83 touch test sensory evaluator in all areas, the patient has normal sensibility and the examination is complete. If the patient does not respond to the 2.83 in all areas, repeat the test with the next heavier touch test sensory evaluator. The exam continues until the patient recognizes a force in all areas, or until it is established that the patient is unresponsive to any touch test sensory evaluator. Complete the mapping using the colored pencil that corresponds to the touch test sensory evaluator that was recognized. Levels of sensibility are measured as normal, diminished light touch, diminished protective sensation, loss of protective sensation, and deep pressure sensation only. These threshold levels correspond directly to the touch test sensory evaluator used. Loss of protective sensation means that the patient will be unable to sense discomfort resulting from ulceration, cuts, blisters, puncture wounds, or pressure necrosis from poorly fitting shoes. Once a person demonstrates a loss of protective sensation, they must be taught to perform self-examinations and given instruction on proper footwear and skin care to help prevent complications. It is shocking to realize how many lower extremity amputations could be prevented through screening for loss of sensation in the diabetic foot. Touch test sensory evaluators provide the data needed to recognize a loss of sensation in the foot. Once the healthcare provider and the patient are aware that a loss of sensation has occurred, a plan of preventive care can be implemented to help reduce the risk of complications that may result in amputation. For more information about the touch test sensory evaluators, please contact North Coast Medical.